I would start by reviewing the orders, reviewing the policy and procedure, and gathering my equipment. Knock, knock. Hi, my name is Emma. I'm a student nurse at LSC. Can I get your full name and date of birth, please?
Morgan Lanin, 6796.
And I just need to check your bracelet, and it matches. So today we're going to be doing a wound culture where I take a swab and I stick it into your wound to get some microbes out of it for a culture. Are you having any pain? No pain?
Nope.
Okay. If you're having any pain in your wound, we could do pharmacological or non-pharmacological interventions, and then we'd give it a little time to kick in before I did anything like that. I have my patient in the bed in a good position. I have my waterproof pad. You would just lift your arm for me. Okay, and then I would check my specimen label for your name, your identification number, the date, the time, the location of the wound, the route, my initials. And then you have a dressing on, so we'll take the dressing off. Just some clean gloves. If the tape were to stick, we could use adhesive remover. And if the dressing were to stick to your wound, we could use sterile saline to get the dressing off without pulling. Then I would check the dressing for drainage, the type, the amount, the odor. And then I would assess the wound for its overall appearance, if there's any drainage, any epithelialization, necrotic tissue, sinus tract. Yeah. And then I would check the skin around the wound. And then I would measure it. And then I could take off my gloves and wash my hands again. And then I would set up a sterile field with sterile gloves, and I would either clean or irrigate the wound according to the orders. And then I would dry the skin around the wound and then put on new gloves. Okay. So then I have the swab here, and making sure to keep everything sterile. I can remove this cap, and then if I needed to move the margins of the wound, I could put one sterile glove on to move the margins. So then with the swab, I would stick it deep into the wound and rotate it several times. If I had to do a different wound, I would get a new swab, and I keep this sterile by not touching anything as I insert it back in. And some swabs have a medium in them. Throw those away and clean my hands again. Okay. And then I would put on new gloves to put on a new dressing. And I would put the date, the time, and my initials. I would take the gloves off again. And I would wash my hands. I would put my label on my specimen and put it in a biohazard bag and send it to the lab. I would clean up. Thank you. I would make sure my patient has their call light, they're comfortable, their bed is in the low position. I would do my documentation. I would wash my hands, and I would be done.